5 things you need to know about nose surgery or rhinoplasty. 1. What areas are addressed with the nose surgery? There are 3 different areas of the nose. One is the rhinoplasty, which is changing the shape of the outer nose. Second is the septum, which is the shaft dividing the nose into 2 chambers, which can be crooked. Thirdly are sinuses. Sinus infections are caused sometimes by a deviated septum and can be alleviated by sinus surgery. 2. Insurance coverage. The rhinoplasty, or the changing the shape of the outside of the nose, is determined by most insurance companies as cosmetic, and they will not pay for it. However, under certain conditions, they will pay for the other 2, that is, the deviated septum and the sinus surgery, if indicated. 3. Open versus closed rhinoplasty, or changing the shape of the outer nose. Some surgeons will only do rhinoplasties with an open incision, meaning that you get a little cut across the bottom of the nose, the columella. Other surgeons may only do it closed, which means the incisions are all up inside. Personally, I do both, depending on the patient and the needs. 4. Recovery. Recovery from a nose surgery depends on which of the sections are addressed. If it's rhinoplasty, then one wears a plastic covering or plaster of Paris covering over the outer nose for about a week. If it's the septum and the sinuses, then little splints or packing of the nose is indicated. Personally, I don't like to pack a nose because it is a horrible experience, and I prefer little magnetic splints that you can breathe around and much more comfortable. 5. Choosing a surgeon. To choose a surgeon may be difficult on this nose surgery because rhinoplasty is the domain of the plastic surgeon to fix the outer or the looks part of the nose, whereas the inside of the nose, the septum and the sinus surgery, is the domain of ENT surgeons or otolaryngology head and neck surgeons. The best way to get a good surgeon that you're sure can do all of this is to have a board certified surgeon qualified in both specialties. So he would be board certified in plastic surgery and board certified in otolaryngology or ENT surgery, period. These are relatively rare. Fortunately, I've been trained in both, but you need to ask about board certification in both of these disciplines to be sure that the surgeon can operate in these 3 areas of the nose. These are the 5 things you need to know about rhinoplasty and nose surgery.